I'm Femi. Okay, I don't need to tell you how many countries around the world are struggling with the coronavirus. Today on the stream, we focus on the Philippines. Have a look here on my laptop. COVID-19 mortality rate by country in Southeast Asia. This is the Philippines. Look at where that bar goes, that line on the graph goes, making the Philippines the second highest in terms of COVID-19 infections and casualties in Southeast Asia. That is the graph. This is what the surge looks like in reality. We are going to be talking about the Philippines and the situation there. Earlier, we spoke to Georgi Engelbrecht from the International Crisis Group, and this is what he told us.
So, the Philippines is not a stranger to disasters. They can be natural or human-made hazards. But COVID-19 is a different type of beast. The virus does not only attack the fragile health system of the country. The economy was hit as well, showcasing the rifts between rich and poor. Meanwhile, higher food prices are exerting an additional strain. Prospects for economic recovery are uncertain. With the presidential elections coming next year, Filipinos will also cast a vote on government's performance. Resilience in the communities remains strong. But how long can this resilience last amid continuing challenges and an uncertain future?
That was one analyst's perspective, but what is yours? You can join our conversation by jumping into the YouTube comment section and asking our guests your questions. So let's talk to the guests. Let's say hello. Dr. Pauline Convocal, hello. Doctor, nice to see you. Hello, Ambassador. Hello, Emmeline as well. Welcome to the stream. Dr. Convocal, introduce yourself to our international audience. Tell everybody who you are and what you do.
Good day, everyone. Thank you, Femi, for the introduction. And also, I'm Dr. Pauline Convocar. I'm the immediate past president of the Philippine College of Emergency Medicine, and I am an active clinician. So I'm currently going on duty as an attending emergency physician in many hospitals here in the metro and 2 other hospitals in the region.
Thanks for joining us. Hello, Ambassador. Welcome. Please introduce yourself to our global audience.
Yes, I'm Jose Manuel Romualdez. I'm the Philippine Ambassador to Washington, D.C.
Welcome. Hello, Emmeline. Nice to have you. Tell everybody who you are, what you do. Very important for today's conversation.
Hi, and thank you, Femi. My name is Emerline Hill. I'm the Deputy Director for Research of Amnesty International, and I'm also a Filipino lawyer.
Welcome. Doctor, I am looking at some pictures that you sent us from earlier on. You were working earlier on today, and I'm just looking at these 2 pictures. What are we seeing here? How do we know this is a surge?
Okay, so it has already been really declared that there's a surge. So there were really sustained spikes in the numbers. We're seeing increased trends for the past a month even. And what you're seeing here are the tents that for patients that are waiting to be taken inside the formal emergency department. So this is part of the expansion of the capacity of our hospital to take in patients, and they're waiting in line to vacant beds inside the hospital.
You were very kind because you've obviously protected the identity of many of these people who are really suffering. This doesn't even look like a hospital. This looks like a temporary setup. There are now field hospitals, temporary hospitals in Manila because, Doctor?
Oh, okay. So since we've been seeing surges and increasing trends, obviously, we can't take them all in. So we just have to make do with whatever it is that we have. So we have to put up tents, increase our capacity by expanding space, adding more beds, even if this will be only in makeshift beds or even in wheelchairs, so that we'll still be able to attend to these patients outside our formal emergency departments.
Emmeline, I'm really curious because we've all been in this global pandemic for over a year now. But when we use the phrase or the term surge, that means something is different. Emmeline, are you seeing something different in terms of your family, your friends, your relatives back at home?
Definitely. So as I said earlier, I am a Filipino lawyer. I've been working as an international human rights lawyer for years. But I am still very much a Filipino lawyer, and I have my family and my friends are still in the Philippines. And for the last 2 weeks, at least 6 friends of mine have passed away because of COVID. And this is really that's not even counting family members of friends. So this is really concerning for me because again, this is not about people who cannot afford healthcare facilities, but it's really now just a matter of people cannot access healthcare facilities because there is not enough to go around.
Ambassador, I want to bring you into the conversation, but first I would like to play a little clip. This is Rosette Lequette. She's a hospital director, and we just got this comment from her a little bit earlier, so we can understand what is going on in hospitals, particularly in Manila. Have a listen, have a look, Ambassador.
Every hospital at the NCR, especially the government hospitals, they are now struggling. We noted an increase in the number of cases, just as we noted increase in the number of health workers being positive. No, in the past, especially in the past since March.
Ambassador, who is running the COVID-19? I would say the fight for COVID-19 in the Philippines. Who is in charge of that? Who is doing that practically down on the ground?
Well, the task force is actually headed by Secretary Carlitos Galvez. He's the one in charge, and he's the one that I've been in touch with on a regular basis, basically to help in procuring the vaccines coming from the United States. I totally understand the situation in the Philippines. I know that it is really very critical, and our healthcare system is really in its very critical stage right now. And to me, I can really see that obviously the only solution or the light at the end of the tunnel that we've always been hearing are the vaccines. And this is exactly what we're trying to do as far as we're concerned here in Washington, D.C., talking to the pharmaceutical companies. We've been in touch with them for more than a year now, well, almost a year actually. And it's unfortunate that the supplies for the vaccines, especially coming from here, has been very, very tight. And it's only recently that President Biden approved vaccines to be made available for the world, specifically the Pfizer that can be exported now from the United States. So this is really the work that we're doing here as far as the COVID-19 response is concerned.
Our audience wants to speak to you, Ambassador, and also Doctor. So I'm going to put this YouTube comment to you. This is from Dr. Warder Feroz. Thank you for being part of the show, Dr. Feroz. Dr. Feroz says, my main concern is that for how long are we going to live like this? Is there any light at the end of the tunnel? Why isn't the WHO responding appropriately? Let me start with you, Doctor, and then go to the Ambassador for a response. Doctor, light at the end of the tunnel, what are you seeing? Are you seeing any light?
Yeah, I have to agree with the ambassador that indeed the vaccines is really the hope and the light at the end of the tunnel. But we have to do something right now. Since we have a problem right now, we have long queues. There's crowding really in the emergency departments. And it may be a grim picture of the current situation of the Philippines. And that vaccine serves as hope for all of us, healthcare workers and the general public, that it may pull us out from this situation. But currently, the demand really and the cries of the people really is that what must be done right now. So all of those congestion, all of those inadequacies in the field. So they're really asking for help on where to seek help for access for the hospitals.
Emmeline, go ahead.
Can I jump in very quickly? Because indeed, I agree with the Ambassador and I agree with Dr. Convocar that vaccines are very important. But I think it's only just one part of addressing this crisis. What's happening in the Philippines now actually exposes the frailty of our healthcare system and how neglected our healthcare system has been for many, many years. And our sense always is that it has never been a framework by the Philippine government. And even with previous administrations, it has never been, the healthcare system has never been seen from the lens as a human right, as a right to health. So you see facilities, you see healthcare workers who are underpaid and who would rather go abroad to seek a better life, to get paid better. So vaccines is just
yeah.
one point, but then
Emelina,
what do we do with the overall system?
Let me bring this to you, because this is really important. This is something that a conversation that is also happening on YouTube, so I want to bounce it off of you. So Sleeping Panda says, I'm concerned about the lack of adequate action by the government, how Filipino nurses are flocking to other developed countries because they're not getting adequately compensated in the Philippines. Does that count as a human right?
Definitely.
Can you
definitely.
explain?
So why are Filipino, some of them are actually, many of them are my friends. They're watching now, friends who are in the United States working as nurses. So I asked them to watch this show. And many of them actually flee or go to the United States or here in London because they don't get they don't get adequately paid for their services, for their skills in the Philippines. So in order to have a comfortable life, in order to be able to pay for necessities in life, they have to go somewhere else. And that is definitely, that's a lot of human rights rolled into one. It does not only mean an impact on the healthcare system in the Philippines, but it also goes to the human rights of the people who are not paid well, so that they have to go to other countries in order to be paid well.
Ambassador, I have seen reports of the military. You're talking about the task force, the COVID task force in the Philippines. The military being accused of overstepping their power, overstepping what they should be doing during a global pandemic. How did you see those stories? Do you feel that there's any credibility to those stories and those complaints about the military?
Well, I'm not quite sure about what are they doing, but I know that the government is, at least initially when they put on the lockdowns, they needed to have obviously persons in authority to be able to implement that. And the military was tasked to be one of those in the front lines to be able to implement the lockdowns. I think for a while it was successful, but in the end, obviously, the economy is starting to show it signs of really becoming again critical situation, especially for those who work every day and they are day wagers, so to speak. Just to mention some of the things that Emmeline said. I agree that, yes, the healthcare situation in the Philippines is quite critical, but of course, no one ever foresaw a pandemic of this type that will ever happen during our time in this century. And so the healthcare is now obviously suffering from that. I remember my brother, who was the health secretary during the time of former President Joseph Estrada, was one of those that pushed for universal care as one of the cornerstones of that administration. And I think it has been recently passed. And at the same time, he was also one of those that pushed for generic medicine to be sold in the Philippines. You know, medicines in the Philippines are one of the most expensive ever. And for a while, the major pharmaceutical companies that we are now having to deal with right now, especially coming from the United States, have a very strong, I would say they had quite a lot of power in the Philippines that they could not get this passed through. But again, that was passed recently, or at least not too long ago, for generic medicines to be available and to make it much cheaper for the majority of our people in the Philippines.
Doctor, I want to play this clip, and this is a tragic story, just one of many tragic stories coming out of Manila over the last few weeks or so. This is from Angelo Barrero, who lost one of his parents to COVID-19. He was searching for a hospital bed and he couldn't find one. Have a listen.
Me and my family, we've moved on or are trying to move on, so we don't really entertain these thoughts anymore. But, you know, maybe if we had a clear plan of action, maybe if we knew that hospitals were a bust, that, you know, we could have just relied on ourselves more rather than spend all that time, 5 hours, you know, looking for a hospital to no avail, really.
Doctor, the way that Angelo puts it is like, if we'd only known hospitals were a bust, it's like, what was the point of spending 5 hours ferrying our parent around Manila? What's the situation like now? How do we address that? Because vaccines are not the immediate solution for that, are they?
If I may just quickly just say something, since the universal healthcare was mentioned by
Sure.
the good ambassador, that indeed universal healthcare is very much really needed right now. But I believe that there can really be no true universal healthcare without emergency care. So all of these things just were exposed or highlighted by COVID. So I agree that we were really not prepared. Nobody was prepared for COVID, but it just exposed so many inadequacies of the Philippine healthcare system, and we've never invested that much for decades. So emergency care is an integral part of universal healthcare, and what was just manifested by one of the one who lost a parent is that in an ideal setting, it should not be the patient or the patient's families who should be looking for hospitals to take them in. So the system should have looked for a place for them. All we need to do is just dial a number in an ideal setting, and as easy as just a 3-digit number to call where you can get advice or where to go to. But currently, it's not really here in the Philippines. It's not. We don't have a system yet. We're getting there, but there's just so many numbers to remember, and they're left on their own way, looking through this maze of the metro, and even in their own private cars, because we don't have really an emergency medical services with competent emergency medical services staff. So there's a long way to go for the Philippines. So even before they leave their homes, ideally, there should already be a plan of where the nearest competent facility or any available bed, for that matter. So
can I jump in very
quickly? It can really be
quickly,
heartbreaking, right?
Emmeline, go ahead.
Just to build on what Dr. Pauline Convocar said. Yes, totally. The implementation of universal healthcare and also the Generic Medicines Act were steps forward in terms of improving the healthcare system in the Philippines, but those are not enough. And I completely agree with Dr. Convocar that emergency care is a component, an integral component of universal healthcare. Also, in the Philippines right now, including people I know, including family members of mine, an illness would still mean severe financial hardship. So this cannot be denied, and we cannot. This is something that I'm still seeing until now in the Philippines.
Ambassador, I'm remembering what you said right at the beginning of our conversation, which is the solution is going to be vaccines, right? It's not going to be immediate, because I'm not sure where the beds are going to come from. Dr. Konfikar showed us just from her shift earlier on today how people were just closely packed together in makeshift temporary hospitals. So I'm just looking at, and I want to share with our audience, a picture of President Duterte getting a vaccine, which I believe was over a week ago. I am wondering, it was yesterday, excuse me, it was even sooner than I thought, even more recent than I thought. I'm wondering, Ambassador, what impact does that have, seeing the President getting a vaccine? What's that value?
Well, I suppose most leaders all over the world, that's one of the things that they do, is to show that the vaccines are supposed to be safe. And I would like to assume that is what President Duterte was trying to show. Here in the United States, we all know the success of their vaccine rollout, obviously because of the resources that they have. We are now seeing the numbers really go down dramatically, and I understand from many states are beginning to open their economy because of the vaccine. So I'm one of those that really truly believes that this is the only way out of this. Now, it's very unfortunate that many countries all over the world, including the Philippines, have very little access to these supplies, because obviously countries, the rich countries, are the ones that are getting it. And you mentioned something about the WHO. We've been working with them through the COVAX facility that they set up. And even then, we still can't get enough of the supplies that we really need. And it's coming in trickles. Yeah. Like, for instance, the Pfizer that we've been working on for more than 7 months now, even before they were given the EUA. It's only now that we were able to finish off the indemnity agreement that they required us to do. So all of this, we're all under the gun on this.
Do you think, Ambassador,
right now with what's
let me just think out loud. Do you think the problem is because the Philippines has a reputation for corruption and lack of transparency. So do you think that is part of the problem about now when you're in a crisis where you do need international help, it might be a little bit on the slow side because of that reputation? Do you think those two things are connected?
Well, I'm not. I don't think that that's the case because, in our case, for instance, the WHO, the World Bank and the ADB are those that are ready to. In fact, they have standby credit for not only for the Philippines, but for many countries in Asia, including Indonesia, and they're the ones that directly pay the pharmaceutical companies. They have representatives here in Washington D.C. We've had a couple of meetings with them. They said, we have the money for you, but there are no vaccine supplies. So it's really, that is really the problem. And we're not the only ones that are suffering from this. And that's why we have to depend on donations coming from other countries like China, and also from what I understand now, Israel is coming up and ready to help us. And other smaller countries that have offered to help the Philippines.
I want to put one more thought into our conversation. This one comes from Christine Sabilo, who's a health and science reporter who is looking at now, where do we go from here in the Philippines? How do we make sure fewer people are dying from COVID-19? This is what she told us.
So with the Philippines reaching 1 million COVID-19 cases, the medical societies and experts I interviewed all recommended basic epidemic response: proper contact tracing, expanded testing, and strict isolation. On top of weak implementation are the gaps in the health infrastructure. Another challenge is local government units are not used to aligning response. So the national government needs to guide them. There are bright spots in some cities, but we need consistency. As simple as having the same contact tracing app and a centralized real-time dashboard on hospital occupancy, which we still don't have. Either the government unifies its COVID response or we wait for everyone to get vaccinated. But with inefficient rollout and the limited vaccine supply, that will likely take a while.
So, Dr. Convacott, I'm also seeing questions on YouTube where people are asking about vaccine hesitancy in the Philippines. So if vaccinations are the answer to how do you reduce the number of deaths, and there's vaccine hesitancy, what do you do as the medical profession to help people?
Okay, we make them understand that really the vaccine is one way out of this pandemic. Unfortunately, really, the vaccines they're not coming in fast enough for all of these, for most of our population to be vaccinated. So with regards to vaccine hesitancy, I think the president having been vaccinated lately is a big optic. It's a good picture of that the public may trust the vaccine, and that most of the healthcare workers are already vaccinated, and they can speak for themselves as well on the trust for the vaccines. But indeed, it is really part of the problem of vaccination, or the vaccine hesitancy, that we need to make the public understand.
I'm just looking here on my laptop to see how vaccinations are doing in Southeast Asia. COVID-19 vaccination rates in Asia at the top. Singapore, this is doses administered per 100 of the population in selected Asian countries. Singapore there is right at the top. China a little bit further behind them. And we have to go all the way down here to the Philippines, and then Thailand is even lower. So this is going to be an ongoing problem. It's an ongoing challenge for people in the Philippines dealing with the surge right now. Dr. Convacott, thank you so much. Ambassador, appreciate you. Emmeline, so much to talk about. Really, thank you very much for helping us shine a light on the surge of COVID-19, the cases there, the casualties there, and really what you need, which are vaccinations, a lot of them. Thank you so much for joining us on the stream. And thank you, YouTube, for being part of our conversation. Always appreciate you. I will see you next time. Take care. Are we still on YouTube? No, then no.